Every day you choose to move, your body responds with strength, balance, and renewed life. Each gentle motion is a gift to yourself, calm, mindful, and full of vitality. Together, we move, we heal, and we thrive. Keep the rhythm of your golden years. Nurture health, cherish every movement. An in-depth examination of the daily movement patterns typically exhibited by older persons in Japan highlights a consistent focus on mild, low-impact, and routine activities that collectively enhance mobility, balance, and overall health. This daily activity pattern differs from the high-intensity facility-based workout routines commonly favored in numerous Western settings. Japan's demographic characteristics, notably its substantial centenarian population over 90,000 individuals aged 100 or older, have garnered persistent global academic attention. Researchers at institutions like Harvard University and the University of Tokyo have increasingly focused on the minor habitual actions or micro-rituals integrated into daily life that may enhance both longevity and health span the duration of life spent in optimal health. These traditional practices are typically not intense workouts. Instead, they consist of intentional mindful movements or postures integrated into routine everyday tasks. They aim to preserve joint mobility, enhance balance, and sustain functional muscle capacity without necessitating specialist equipment, gym memberships, or significant time investments. This strategy embodies a preventive philosophy. Regular moderate exercise is employed to mitigate age-related issues such as morning stiffness, joint pain, and reduced postural stability. The objective is to prioritize maintenance and resilience over optimal performance. This technique presupposes continuity. Minor daily inputs in mobility accumulate over months and years to yield significant functional advantages. The remainder of this study provides a detailed analysis of 6 distinct movements or postural practices originating from Japanese cultural and martial traditions. Each practice is delineated with a focus on its biomechanical foundations, the scientific evidence substantiating its advantages, and pragmatic instructions for secure and effective execution by older adults. Collectively, these movements derived from sumo tradition, formal kneeling martial arts postures, seated meditation slow arm sequences, and a basic towel-based spinal exercise constitute a succinct, versatile routine that can be executed in approximately 15 minutes and modified to accommodate diverse functional capabilities. The subsequent discussion encompasses proposed weekly progressions, prevalent adaptations for medical conditions, integration strategies for caregivers and physicians, and methods to assess significant change over time. 1. Shikodachi, the broad stance isometric. The initial practice is shikodachi, the broad-legged posture linked to sumo. Shikodachi, although mostly acknowledged as a ritualistic and performance stance in the sport, possesses practical benefits for older persons as an isometric training position that fortifies the lower body and core, aiding in fall prevention and the maintenance of independence. Biomechanically, shikodachi resembles a wide stance squat, with the feet positioned significantly wider than shoulder width and the toes angled outward. This stance reduces the body's center of gravity and provides a wide base of support. Maintaining the posture engages several major stabilizing muscle groups simultaneously. The quadriceps and hamstrings serve as principal stabilizers at the knee, crucial for standing stair climbing and ambulation. The gluteal muscles facilitate hip extension and maintain postural integrity, thereby reducing strain on the lumbar spine. The adductors support pelvic alignment and unilateral stability, and deep core stabilizers, including the transverse abdominis and erector spinae, activate to uphold an erect spinal column and safeguard the torso. Empirical evidence endorses the efficacy of wide stance squat variations for elderly populations. A study by researchers at the Tokyo University of Science investigated the impact of squat-based training on hip stability and fall risk in older persons, revealing enhancements in hip stability exceeding 40% and a significant decrease in fall risk among participants. The benefit of shikodachi is in the engagement of smaller, stabilizing muscles and neuromuscular circuits sometimes overlooked by traditional machine-based gym exercises or repetitive aerobic activities like treadmill walking. The smaller muscles facilitate the micro-adjustments required for traversing uneven surfaces or executing swift posture corrections. A distinct intervention study conducted in Japanese nursing homes revealed that a 4-week program focusing on shikodachi practice resulted in superior improvements in leg strength and standing balance compared to a standard treadmill walking program, indicating that the isometric and multiplanar requirements of the stance provide unique neuromuscular benefits. Pragmatic directives and advancements. To practice this position safely and efficiently, meticulous attention to form is essential. Commence by positioning the feet wider than shoulder width. An effective first distance is approximately 1.5 times shoulder width, though personal comfort and hip mobility will affect the optimal posture. Externally rotate the toes to an approximate angle of 45 degrees. Commence the descent by flexing the knees while maintaining an upright spine and an open chest akin to lowering oneself toward a chair. Descend only to a comfortable and pain-free extent, ensuring that the knees align with the toes to prevent excessive medial or lateral strain on the knee joint. Maintain the posture for 30 seconds, breathing slowly and intentionally while engaging the deep abdominal muscles to stabilize the spine. To escape, apply pressure through the heels and extend the knees to resume a standing position. Novices should execute shikodachi adjacent to a countertop wall or robust chair to offer a handhold for balance when required. Depth should not be compelled. A superficial grip, nevertheless, facilitates significant engagement of the target musculature and may be gradually intensified as mobility and strength improve. Advancements and setbacks. Regression, decrease stance width, maintain hands on a support, or grasp a chair for partial weight-bearing assistance. Repetitions of sit-to-stand transitions from a low chair can replicate the movement in a more secure setting. Progression augment hold duration in 10-15 second increments, weekly introduce subtle micro-squats inside the stance, or integrate modest lateral weight changes to enhance dynamic stability. Intensity modulation, execute unilateral shikodachi variants by subtly redistributing weight to one leg or maintaining the stance while rotating the head and torso to enhance coordination. Supplementary pragmatic indicators. Envision extending the knees slightly outward to maintain alignment with the toes so mitigating valgus collapse. Concentrate on respiration, inhale to prepare exhale while maintaining the most profound, comfortable position. Refrain from breath holding as it may elevate blood pressure. Employ tactile feedback. Softly position hands on the thighs to assess muscle engagement. Contraindications and precautions. Acute discomfort in the knee or hip, recent joint replacements, or advanced osteoarthritis may necessitate medical clearance. Individuals with severe cardiovascular diseases should regulate their exertion and refrain from breath holding. Monitor for valgus collapse, inward knee movement, and excessive forward trunk inclination. Both diminish safety and efficacy. In addition to physical advantages, consistent practice of shikodachi can yield psychological benefits as lower limb strength and balance enhance confidence in one's capacity for safe movement generally increases, so facilitating increased everyday activity and autonomy. Monitoring basic objective metrics such as duration of stance pulse count or proficiency in executing daily activities, e.g. standing from a low chair without arm assistance can effectively illustrate progress and encourage further practice. 2. Seiza formal kneeling for posture and flexibility. The second practice is seiza, the traditional formal kneeling position frequently observed in tea ceremonies, religious or ritual contexts, and in the ordinary seated of older generations. Although it may initially seem like a basic kneeling position, seiza serves as a corrective posture for spinal alignment and aids in maintaining flexibility in the knees and ankles when executed correctly. Assuming the seiza position promotes a naturally aligned spine as the head, shoulders, and hips align, hence mitigating the forward head posture and sagging upper back, sometimes associated with extended periods of sitting in a chair. This alignment diminishes compressive stress on the intervertebral discs and alleviates muscular tension in the back and neck. This position elongates the quadriceps and the connective tissues, encircling the ankles and the dorsal surfaces of the feet, aiding in the preservation or restoration of range of motion. Maintaining an erect torso in seiza necessitates subtle, continuous engagement of the deep postural muscles of the core, hence enhancing endurance in the muscles that facilitate daily upright posture. Practitioners and viewers have also observed ancillary benefits for circulation and digestion, as an upright torso facilitates respiratory mechanics and intra-abdominal organ function, free from the compressive effects of a deflated chest. While randomized trials, particularly focusing on seiza, are scarce, its mechanisms align with previous findings in physical therapy and respiratory research. Research from Harvard Medical School and other institutions has demonstrated that postures allowing thoracic expansion and maintaining spinal neutrality can enhance diaphragmatic movement and optimize breathing, subsequently inducing calming effects through parasympathetic activation. In regions of Japan renowned for remarkable longevity, such as Okinawa, it is prevalent to observe elderly individuals who can comfortably maintain the seiza posture for prolonged periods. Cultural familiarity with this position and the lifelong practice of sitting in this manner are believed to contribute to the preservation of joint mobility and postural integrity. Secure adoption and pragmatic advice. The secure adoption of seiza necessitates gradual acclimatization, particularly for individuals with pre-existing knee and ankle ailments. Training should commence on a pliable surface such as a carpet or yoga mat. Assume a kneeling position with the legs aligned and the dorsum of the feet flat against the floor. Subsequently, descend the hips to rest on the heels while maintaining an erect spine and relaxed shoulders. Commence with brief holds of 30 seconds to 1 minute, maintaining steady respiration. As strength and endurance enhance, prolong the duration. Typical adaptations involve positioning a firm cushion or a folded blanket between the heels and hips to diminish the extent of knee and ankle flexion. This straightforward support might render seiza attainable for individuals who otherwise experience discomfort in full kneeling. Specialized seiza benches are designed to produce the same impact while avoiding compressive stress on the knees. For individuals unable to kneel securely, a viable alternative is to sit at the edge of a chair with the feet positioned beneath the knees and the spine maintained in an erect posture as though an invisible rope were elevating the crown of the head. Consistent brief practice of seiza or its chair-based equivalent, even for a few minutes daily, can provide significant enhancements in posture and comfort over time. Advancements and deliberations. Begin with 30 to 60 seconds and increment by 15 to 30 seconds every few days as tolerated. Employ supplementary padding during initial practice, as flexibility in the ankle and knee enhances progressively diminish the padding. Alternate seiza with easy range of motion exercises for the ankles and knees to prevent stiffness, e.g. ankle circles, calf stretches. Observe for numbness, tingling, or acute pain. These are indicators to modify positioning or to cease activity until assessed by a professional. Cultural and social assimilation. Seiza is not merely a position but also an element of social rituals. Using it over tea or conversation might provide brief sessions within a daily routine, so enhancing compliance. For caregivers and group programs, supervised seiza sessions can serve as an economical enhancement to community activities, providing both physical alignment and social interaction. 3. Neko Ashidachi, the feline paw stance for equilibrium and proprioception. The third practice originating from martial arts is termed Neko Ashidachi, commonly translated as the cat's paw stance. This stance emulates the poised lightness and alertness of a cat, with the majority of body weight supported by the rear leg, while the front foot lightly touches the ground, resulting in a deliberately asymmetrical and unstable posture. This design serves as an exceptional training apparatus for balance proprioception and swift postural correction attributes essential for mitigating fall risk in elderly individuals. Falls are a primary source of injury in older adults, sometimes resulting not from an abrupt loss of strength, but from transient balance disruptions or delayed neuromuscular reactions. Neko Ashi Dachi exercises the body's sensory-motor system to identify and rectify minor disturbances before they result in a complete loss of balance. The posture challenges proprioceptive signals from muscle spindles, joint receptors, and cutaneous sensors in the foot, eliciting constant feedback loops between the periphery and the central nervous system. The stabilizer muscles in the ankles, foot hips, particularly the gluteus medius, and the core must execute quick, precise contractions to sustain an upright posture. Consistent practice thus fortifies the intrinsic muscles of the foot and ankle, along with the hip abductors and rotators that enhance single-leg stability. Furthermore, the position enhances rapid reflexive reactions to destabilizing pressures, refining the neuromuscular timing essential for effective recovery from trips and slides. Proof and results. At the population level, entities like the World Health Organization emphasize the prevalence of falls among the elderly, indicating that approximately 1 in 3 individuals over the age of 65 suffers at least one fall annually. Empirical research from Japanese universities corroborates the effectiveness of balance-oriented programs. A study conducted at Kyushu University detailed a regimen in which elderly participants engaged in offset single-leg or asymmetrical stances, similar to Neko Ashidachi, resulting in a 55% decrease in fall risk after 6 weeks. Comparable foreign balance programs have shown enhancements in timed up-and-go assessments, single-leg stance duration, and gait stability metrics following brief treatments, highlighting the responsiveness of balance systems to focused training. Introduction. Exercises and safety protocols. Safety is crucial when introducing Neko Ashidachi. Execute the exercise while situated adjacent to a wall countertop or robust chair. Begin by transferring the majority of your weight onto your rear leg, then advance the other foot forward minimally, allowing the front foot to make light contact with the ground using the ball or toes. The weight distribution must be predominantly on the back leg, with both knees slightly bent and the spine erect. Maintain the position for 20 to 30 seconds on each side, inhaling steadily and concentrating on a stable posture. Progressions may be implemented once the fundamental stance is stable, gradually rotating the head to stimulate the vestibular system, intentionally moving the arms to modify mass distribution, or incorporating brief holds with eyes closed to increase sensory demand. Seamless incorporation into daily routines is simple. Engage in brief intervals of Neko Ashidachi while brushing teeth, stirring food on the stove, or waiting for the kettle to boil, always providing a support surface is accessible. This exercise functions as a type of insurance for sustained independence. Each repeat fortifies the neural connections and muscle reactions that prevent a potentially harmful fall. Advancements and setbacks. Regression limit. Hold durations to 10 seconds, sustain contact with a support, or engage in practice with a more restricted forward step to enhance front foot contact. Progression. Extend duration briefly. Close eyes. Execute mild weight shifts in various directions or conduct gradual controlled kicks from the light contact front foot to promote dynamic stabilization. Multitasking. After achieving basic balance stability, incorporate simple cognitive tasks, e.g., counting backward to enhance dual-task resilience frequently associated with real-world fall situations. Frequent missteps. Locking the knees diminishes shock absorption and may exert strain on the joints. Maintain a slight bent. Breath holding elevates intrathoracic pressure and may disrupt blood pressure management. Engage in consistent diaphragmatic breathing. Excessive dependence on assistance hinders adaptation. Utilize supports to avert falls while gradually diminishing reliance. 4. Zazen sitting meditation for autonomic regulation and cognitive fortitude. The fourth practice focuses on zazen, or seated meditation. In contrast to other practices that focus on muscular or joint training, zazen is chiefly a discipline for the mind and the autonomic nervous system. In Japanese concepts of wellness, mental and emotional states are intricately connected to physical health. Consistent zazen practice fosters mental clarity, emotional regulation, and an improved mind-body connection, all of which strengthen physical resilience. The fundamental physiological aspect of zazen is concentrated attention on the breath while sustaining an erect, stable posture. This pattern stimulates the parasympathetic nervous system and diminishes sympathetic arousal, resulting in decreased heart rate and blood pressure, as well as a reduction in circulating stress chemicals like cortisol. Chronic stress contributes to systemic inflammation and several age-related disorders. Thus, the stress-reducing benefits of zazen are pertinent to healthy aging. Cognitive advantages also manifest. The continual practice of redirecting attention to the breath fortifies the prefrontal cortex, the brain area responsible for executive tasks, like as concentration, working memory, and emotional regulation. Neuroimaging studies at institutions like Osaka University have shown that prolonged meditation practice correlates with enhanced gray matter volume in the hippocampus, a critical structure for learning and memory, and may aid in maintaining the integrity of prefrontal cortical areas susceptible to age-related deterioration. Execution and modifications. The Japanese Ministry of Health's use of meditation methods such as zazen in national senior wellness initiatives underscores the acknowledged significance of contemplative practices in holistic aging models. Zazen promotes physical health and functional recovery by soothing the nervous system and improving cognitive resilience. Zazen is attainable for individuals with varying physical capabilities due to the availability of diverse postural alternatives. The fundamental biomechanical component is a linear, unstrained spine. One may adopt a cross-legged posture on a firm meditation cushion, zafu, utilizing the elevation to facilitate a slight forward tilt of the pelvis while maintaining a neutral lumbar curve. Alternatively, the traditional seiza position may be employed with or without a cushion or small bench to minimize knee flexion. Individuals with restricted hip mobility may adopt an appropriate posture by sitting erect on a chair with feet flat on the floor and a vertical spine avoiding any reclination against the chair back. Gently close your eyes or lower your gaze and focus on your breath and expiration. Upon the emergence of ideas, recognize them non-judgmentally and redirect focus to the breath. Commence with concise sessions lasting 2 to 5 minutes, once daily, ideally in the morning, and progressively increase the duration as comfort and concentration improve. The aim is not to attain a vacant mind or a state of flawlessness, but to cultivate a regular practice of conscious awareness. Pragmatic indicators and advancements. Focus attention on a particular sensation, e.g. the airflow at the nose, the expansion and contraction of the abdomen, which facilitates a recovery from distraction. Utilize guided recordings for initial practice to avoid frustration. Gradually increase to 10 to 20 minutes daily as tolerated. Brief recurrent sessions 2 or 3 times daily can match or surpass the advantages of a singular extended session. Integrate zazen with mild diaphragmatic breathing techniques during periods of anxiety or elevated cardiovascular arousal. Clinical considerations. Individuals with significant cognitive impairment may nevertheless derive advantages from structured brief meditations centered on breath awareness. Modifications and caregiver assistance contribute to ensuring safety and interest. Individuals with orthostatic hypotension should ascend gradually following seated meditation and observe for dizziness. 5. Kata arm flow, deliberate, methodical arm sequences for enhanced mobility and synchronization. The fifth drill is a kata arm flow, a streamlined variant of the coordinated movement sequences employed in martial arts forms. Kata, meaning form, are organized routines that synchronize posture, breathing, and focus. An elegant fluid arm regimen utilizes these concepts and is especially beneficial for maintaining shoulder mobility, strengthening upper thoracic circulation and improving the coordination of breath and movement. Gradual, deliberate arm circles and sweeping movements engage the shoulder complex in an extensive range of motion, aiding in the preservation of rotator cuff flexibility and mitigating the danger of adhesive capsulitis frozen shoulder. This exercise activates the motor cortex by the necessity of precisely timed muscle activation, enhancing fine motor control and body awareness. Empirical evidence supports the cognitive and physical advantages of slow, form-oriented movement techniques. A neuroscience journal indicated that older adults engaging in slow martial arts for 2 months exhibited enhancements in shoulder range of motion and specific cognitive metrics, demonstrating how coordinated mindful movement concurrently supports both motor and cognitive functions. In numerous Japanese communities, groups of seniors engage in analogous slow movement exercises in parks before dawn, a culturally ingrained habit that strengthens communal bonds while providing quantifiable health advantages. Methods for executing and modifying the flow. To execute a fundamental kata arm. Flow position. The feet shoulder width apart with the knees slightly flexed. Coordinate breath with movement. Inhale while elevating the arms to shoulder height in front of the body, extend them forth and upward in a fluid arc, and exhale as you return the arms down to the sides. Envision the arms traversing a viscous medium like warm water. This visualization aids in sustaining a deliberate, controlled pace. Engage in the flow consistently for 2 to 5 minutes, emphasizing seamless transitions, relaxed shoulders, and synchronized breathing. Movements may be modified for a seated posture if standing proves challenging, and the tempo can be further reduced to alleviate shoulder strain. Training objectives and variations. Circular motions, forward and backward arm circles, engage the complete shoulder range of motion. Diagonal sweeps traverse the midline to enhance thoracic rotation and scapular regulation. Engage the core subtly during each sweep to enhance trunk-limb coordination. Cognitive layering, commit brief sequences to memory to enhance memory and sequencing abilities. Safety considerations. Refrain from sudden jerks or high-amplitude ballistic movements when experiencing shoulder pain or following a recent injury. Initiate with gradual mobilizations of the neck, shoulders, and upper back if stiffness is significant. Sharp or chronic pain indicates the necessity for regression or medical assessment. Community and compliance group workshops or park gatherings offer social reinforcement, a crucial factor in adherence among older persons. Music characterized by a languid beat or a measured cadence might facilitate tempo retention and enhance the enjoyment of practice. 6. Tenugui. Twist towel-aided thoracic rotation and core activation. The 6th practice utilizes a ubiquitous household object, the tenugui, a slender cotton towel, as a straightforward instrument for spinal rotation and core engagement. This movement, occasionally referred to as tenugui taiso towel exercise, focuses on enhancing thoracic rotational mobility and activates the deep stabilizing muscles of the trunk. In Japan, clinicians occasionally denote the term spinal age as a functional measure of vitality, where a more flexible and well-aligned spine correlates with improved health outcomes in later life. The tenugui twist highlights modest thoracic rotation while applying a mild isometric force via the arms and hands. The exercise promotes segmental mobility of the thoracic vertebrae, an area that often becomes rigid due to aging and inactivity. The act of pulling the towel apart while rotating the torso generates continuous isometric tension in the chest and shoulder areas, thereby engaging the transverse abdominis, external and internal oblique muscles, serratus anterior for scapular stability, and multifidus muscles for localized spinal segmental support. The persistent tension also tests the grip, thereby enhancing the intrinsic muscles of the hands and forearms. Clinically, enhancements in grip strength correlate with overall vitality and capability in elderly people. Hence, therapies that integrate grip exertion with core activation may significantly impact functional independence. Empirical data and clinical observations. A study conducted by Nagoya University examining a Tenugui Taiso practice revealed that participants attained significant improvements in grip strength, spinal mobility, and coordination following a 4-week program. Concurrent findings from researchers at Kyoto University suggest that a brief daily activation of core stabilizing muscles, specifically 5 minutes daily, may diminish the occurrence of lower back injuries by around 60% and enhance sleep and digestion in a short time frame. The Tenugui twist specifically engages numerous defensive muscles associated with these results. Execution regressions and progressions. To execute the Tenugui twist, position yourself either seated or standing, with an erect spine grasping a towel horizontally at shoulder level, with hands positioned shoulder width apart. Establish mild outward strain by tugging the towel as if striving to elongate it, sustaining that isometric pull throughout the motion. Maintain the pelvis and lower body in a forward position, while gradually rotating the torso, arms, and head to one side to the extent of comfort. Pause, then return to the center and rotate to the opposing side. Synchronize the movement with your breath by exhaling during the rotation and inhaling as you return to the center. Execute alternating rotations at a deliberate pace for roughly 2 minutes per session. The exercise can be readily modified for varying abilities. Decrease the rotation range or towel tension if pain or dizziness arises, and consistently emphasize a smooth, controlled pace rather than vigorous twisting. Advancements. Regression: diminish tension by loosening the grip on the towel, executing lesser rotations, or maintaining bent elbows to shorten the lever arm. Progression. Elevate tension, maintain the end range for several seconds, or execute slow rotational holds while standing on an unstable surface, e.g. foam pad, for an advanced proprioceptive challenge. Integrate breathing exercises. Incorporate a pelvic floor and core activation prompt during exhalation to enhance the engagement of stabilizing muscles. Contraindications. Individuals with acute back pain, recent spinal surgery, or recognized unstable spinal disorders must obtain medical clearance before engaging in rotation-based exercises. Individuals with vestibular problems should rotate gradually and observe for dizziness. A cohesive philosophy: the rationale behind the synergy of these 6 practices. Collectively, these 6 practices, the wide stance isometric of Shikodachi, the postural alignment of Seiza, the balance training of Neko Ashidachi, the mental regulation of Zazen, the mobility and coordination of the kata arm flow, and the rotational core work of the Tenugui twist embody a cohesive philosophy of aging that prioritizes consistency, accessibility, and mindful engagement over intensity and sporadic effort. Each exercise addresses a distinct complementary aspect of the challenges related to aging: sustaining lower body strength, maintaining spinal alignment and flexibility, mitigating fall risk via enhanced balance, and reflexes supporting cognitive and autonomic regulation, ensuring mobility of the shoulder complex and arms, and safeguarding the spinal column through core stabilization and rotational mobility. These activities can be executed together in roughly 15 minutes daily and necessitate minimal or no equipment beyond household objects. Formulating a 15-minute daily regimen: minutes 0-2, concise warm-up, gentle marches in place, ankle rotations, shoulder rotations. Minutes 2-6, Shikodachi holds 2 holds of 60 seconds each, with a 30-second respite or sequence of holds, pulses. Minutes 6-8, practice Seiza, or an upright seated position for 2 minutes utilizing a cushion as necessary. Minutes 8-10, Neko Ashidachi holds 20-30 seconds per side, repeat twice. Minutes 10-12. Kata arm flow, uninterrupted slow arm sequences. Minutes 12-14. Tenugui twist alternating rotations. Minutes 14-15. Concise zazen or diaphragmatic breathing to reinforce practice. The proposed sequence deliberately alternates between demands, static, lower body holds, seated postures, balance exercises, upper body mobility, rotating core activation, and concludes with relaxation, aiming to mitigate localized fatigue while preserving overall stimulus. If an individual perceives a specific element as particularly exhausting, adjust the time allocation, for instance, reduce shikodachi duration and extend kata arm flow while maintaining an equivalent total session duration. Sample weekly progression plan. Week 1. Acquire proper technique. Brief retention intervals focus on safety and respiration. Concentrate on signals and comprehending kinetic sensations. Weeks 2 to 3 incrementally enhance hold durations and repetitions. Incorporate minor progressions, e.g. balance with eyes closed. Implement uncomplicated dual tasking for balance training. Weeks 4 to 6. Implement small difficulties, dual task balancing, extended zazen, assess improvements in functional outcomes, e.g. ease of sit to stand. From month 2 onward, customize the routine according to preferences, progress, and any clinical feedback. Incorporate diversity to avert monotony and sustain interest. Assessing advancement and results. Quantifiable and significant metrics encompass duration of retention in shikodachi seconds, duration of single-leg stance seconds for each leg, 5 times sit-to-stand test seconds, grip strength measured in kilograms using a dynamometer where applicable, range of shoulder mobility self-reported reach or quantified degrees, subjective assessments, confidence in ambulation, fear of falling metrics, sleep quality, evaluations, pain, intensity ratings, and daily functional capabilities, such as the capacity to rise from a low chair or ascend stairs. Periodic evaluation every 4 to 6 weeks facilitates progression and sustains motivation. Basic daily records calendars or smartphone reminders can aid in monitoring and strengthen habit development. Safety contraindications and indications for clinical consultation. All programs for seniors should include a concise assessment for medical contraindications. Request clinical guidance if there is recent cardiac incident, uncontrolled hypertension or exertional dizziness, recent orthopedic surgery, joint instability, or advanced osteoporosis, neurological disorders resulting in recurrent fainting or syncope, novel unaccounted for discomfort throughout training, pragmatic warning signs during practice. If experiencing chest pain, excessive dyspnea, or near syncope, cease all activity immediately and obtain medical assistance. If experiencing sharp shooting pain in the back or limbs, cease activity and consult a clinician. If experiencing persistent numbness, growing weakening, or unmanageable dizziness, discontinue the activity and seek evaluation. Healthcare professionals, caretakers, and public health officials can assist older persons by instructing safe progressions, promoting consistent practice, and facilitating the adaptation of movements to suit individual capacities and medical backgrounds. In group environments, qualified teachers may monitor and rectify techniques, avert hazardous advancements, and promote social engagement, which is a factor in good aging. Integration of evidence and constraints. The scientific literature and observational data from lifespan hotspots in Japan substantiate the efficacy of these methods. Interventions emphasizing wide stance, strength, balance, specific postures, targeted core stabilization, deliberate coordinated movements, and contemplative breath-centered practices have been linked to positive results in hip stability, fall risk mitigation, grip strength, spinal mobility, and cognitive function. A mechanistic understanding derived from biomechanics, neurophysiology, and geriatric medicine substantiates the potential benefits of these micro-rituals: enhanced neuromuscular control, improved postural alignment, increased thoracic mobility for respiration, and less chronic stress burden. Nonetheless, there are constraints to the evidence that must be recognized. Comprehensive, high-caliber, randomized, controlled trials that isolate individual micro-rituals and conduct direct comparisons with other therapies are notably limited. Numerous beneficial outcomes emerge from comprehensive community initiatives that integrate physical activity, social interaction, nutrition, and active living. Observational research from longevity regions are influenced by confounding factors like, as genetics, lifelong exercise patterns, food, and social networks. Results from limited or single-site research may not be applicable to varied populations with variable baseline health cultural backgrounds or living conditions. The dose-response connections for numerous practices remain inadequately delineated. Nonetheless, mechanistic plausibility controlled intervention studies on associated movement patterns and the low-risk, low-cost characteristics of these behaviors advocate for their incorporation into a holistic aging strategy. In contexts where higher intensity resistance or aerobic training is therapeutically suitable and accessible, these micro-rituals serve to enhance rather than supplant those programs. Practical execution strategies to improve compliance. Habit stacking, integrate brief practices into established daily routines, e.g. execute neko ashidachi while cleaning teeth. Social reinforcement, establish or participate in small neighborhood groups for collective practice. Community parks and senior centers in Japan frequently organize such assemblies which amalgamate physical and social advantages. Employ cues and reminders, establish a daily alarm place, a towel prominently on a table, or position a cushion beside a preferred chair to stimulate practice. Monitor and commemorate minor achievements, document durations, repetitions, or functional enhancements, and recognize progress. This maintains motivation. Adjust to the season and surroundings during adverse weather conditions. Practicing indoors with a chair or cushion serves as a viable alternative. Enhance enjoyment, play, soothing music practice by a window, or integrate sessions with social interactions to establish positive connections. Responding to prevalent inquiries and apprehensions, I lack time. Brief sessions, 10-15 minutes daily, can effectuate change when practiced consistently. Even 2-minute exercises conducted several times a day are advantageous. I experience knee pain. Utilize cushions for seiza, reduce the depth of shikodachi, and seek advice from a physician regarding joint-friendly progressions, such as isometric holds or sitting-to-standing exercises that enhance strength without exacerbating discomfort. I lack flexibility. Initiate with limited ranges of motion and gradual exposure. Regular practice frequently results in observable enhancements in flexibility and functionality within weeks. Is meditation essential? Zazen, although not essential for physical improvements, provides supplementary advantages for stress alleviation, sleep quality, mood enhancement, and cognitive regulation, while also fostering commitment through a tranquil and intentional attitude to movement. Incorporation with additional health practices. The efficacy of micro-ritual movement practice is maximized when it is integrated with proper diet, sufficient protein and micronutrients, sleep hygiene, social interaction, and consistent medical treatment. Resistance training, when possible, enhances these practices by providing load-specific strength improvements. Aerobic exercises like brisk walking promote cardiovascular health. Medication evaluations, bone health exams, and ocular and podiatric care are essential adjunctive medical interventions to enhance safety and functionality. The methods outlined are not incompatible with other exercise regimens. Instead, they offer a sustainable, accessible foundation that enhances daily functional capacity and diminishes obstacles to higher intensity training when suitable. Practical case studies. Mrs. A, aged 74, diagnosed with minor knee osteoarthritis, commences with seiza utilizing a cushion, performs brief shikodachi holds with diminished depth and hand support, and engages in seated kata arm flow. After 6 weeks, she reported less morning stiffness, enhanced capability to access high kitchen shelves, and increased confidence when transporting groceries. Mr. B, aged 80, who has a fear of falling, does neko ashidachi near a countertop, progressively closes his eyes for short durations, and incorporates tenugui twists to enhance core stability. Following a 2-month period, his single-leg stance duration improves, and he experiences a reduction in instances of stumbling. Group Class, a community center, conducts 15-minute morning classes that include all 6 activities, promoting both compliance and social interaction. Participants indicate enhanced mood and elevated weekly activity levels. Final assessment. Individuals aiming to preserve functional independence and alleviate discomfort with aging should adopt a regular regimen of these brief intentional actions as a practical approach. Regular participation, even in minimal amounts, improves neuromuscular coordination, maintains joint flexibility, supports cardiovascular and autonomic functions, and bolsters the psychological confidence essential for active aging. The 6 techniques outlined, Shikodachi Seiza, Neko Ashi Dachi Zazen Kata arm flow, and the Tenugui twist, are rooted in cultural traditions while being substantiated by modern biomechanical insights and empirical evidence. They are versatile, economical, and practicable to execute in domestic or community environments. When integrated with a focus on nutrition, sleep, social interaction, and regular medical treatment, these culturally embedded micro-rituals offer a scientifically validated, scalable framework for fostering a longer, healthier, and more independent later life. Healthcare professionals and caregivers can significantly contribute by evaluating safety, instructing on adjustments, and promoting incremental advancement. Community groups and public health programs can enhance their impact by integrating these behaviors into social routines, providing teaching and establishing safe environments for older individuals to engage collaboratively. The significance of these micro-rituals resides not only in the physiological changes they engender, but also in their capacity to structure daily existence. Movement transforms into a routine, communal, and purposeful aspect of a fulfilling life, rather than an irregular, onerous duty. Every day you choose to move, your body responds with strength, balance, and renewed life. Each gentle motion is a gift to yourself, calm, mindful, and full of vitality. Together we move, we heal, and we thrive. Keep the rhythm of your golden years, nurture health, cherish every movement.